Unit 5 about life skills education, and Chapter 2 of this unit is sexually transmitted infections. And the topic here is to know the difference of disease and infection. Most of the time, people get confused with these two words and they use them interchangeably. But these terms are totally different in their meanings and applicability, though they share the same passage and reasons of occurrence. Now let us see first, what is infection? Infection is often the first step which occurs when bacteria, viruses, or other microbes that cause disease enter the body and begin to multiply. So an infected person does not necessarily have any signs or symptoms that the virus or bacteria is actually hurting his or her body, as they do not necessarily feel sick at all. Whereas a disease is when it occurs when the cells in the body are damaged as a result of the infection and signs and symptoms of an illness appear. So a disease here means that the infection is actually causing the infected person to feel sick or to notice something is wrong. Now let us see what are the key differences between infection and disease. There are 4 key differences between these two. Number 1 is infection is an attack and growth of microorganisms inside the body of a person, whereas a disease is when an infection causes the infected person to feel sick. Number 2 difference is infection occurs when bacteria, viruses, and other microbes that cause disease enter the body and begin to multiply. Whereas a disease occurs when the cells in the body are damaged as a result of the infection. Number 3 difference is in infection, different symptoms are shown by the body of a different kind of infection, whereas in disease, specific kind of disease exhibits specific kind of symptoms in the body. And the last difference is in infection, if properly diagnosed, it can be treated, whereas in disease, if proper care is not taken, infection shapes into big and life-threatening diseases.